Yeah, is this Mario Davalos?
Yes, this is me.
Yeah, this is Jeff with the YouTube channel DSH-ABUSE. I'd like to do an interview with you. Do you consent to being recorded?
Yes, it's okay.
Yeah, okay. So today's date is August 19th, 2020, and you're a patient at Atascadero State Hospital, correct?
Yes.
Okay, and you're what's considered an MDO, mentally disordered offender?
Yes. And
you've been at Atascadero for how long? 2 years?
2 years, 8 months. 2 years, 8 months.
2 years, 8 months. Okay. And you currently have a job on your unit of doing the laundry?
Yeah, laundry.
Okay. And what do you do with the laundry?
I fold it, I put it away, I stock it, and put it away in the bins, the dirty clothing.
Right. The clean clothing, right?
Dirty clothes.
What
dirty clothes I put in a bag and put it in the bin. In a bin.
In a bin. Okay. And how many times a day do you do that?
I do that once a day.
Once a day. At night?
No, I mean I do it twice a day. I mean.
Twice a day. And you're on Unit 3, right?
Yeah, Unit 3.
Yeah. How long have you been doing this?
I started on Monday.
On Monday. Okay, and there was another guy that was doing that?
Yeah, he went home and he discharged.
How long was he doing it for?
He was doing it for probably about 2 weeks.
Weeks? And that's a paid job? They pay you for that?
Yeah, it's a paid job. Excuse me?
How much they pay for that?
$7.25.
And he was doing it for 2 weeks. What about before him?
Before him was I can't recall the person before him. He went home too, or he discharged.
Was there another guy doing it for a long time?
Yeah. Yeah, he went home though. I forgot. Right. I forget who it was though. I'm not too sure.
I thought MDOs couldn't make $7.25 an hour. Is that not true?
They changed it. As of last year, they changed it.
They changed it last year.
Yeah, as of last year, they changed it.
So the MDOs can make $7.25 an hour. So, what's that?
Everybody makes $7.25 now.
Okay.
So,
now, what about feces, shit? When you come across shit, have you come across any shit?
No, I haven't.
What would you do if you came across shit? What would you do with that?
Well, you gotta tell the staff, and then you gotta put it in the yellow bag, put gloves on, and put it in the yellow bag.
Now, when you sort the laundry, are you using gloves or you just use your hands?
No, I use my hands.
You just use your hands?
Yes. Okay,
you're not using gloves right now?
No.
Okay, but you would only use gloves if you found some shit.
Yes.
Okay. What about a mask? Right, you wearing a mask when you're doing the laundry?
Yeah, they told me to start wearing a mask. Since the first day I started on Tuesday, they told me to wear a mask. Okay, wear a mask. Yeah, and I've been wearing it ever since.
But they told you to wear a mask, but they didn't tell you to wear gloves?
No gloves.
Okay, so the staff told you to wear a mask, but no gloves?
Yes.
Okay. That's interesting. Now, so they told you if you come across feces to put it in a yellow bag?
Yes.
Okay. Do you remember who told you that?
No, I don't remember.
Okay. Are you familiar? Do you know about the coronavirus?
Yes.
Okay. What do you know about the coronavirus?
That it messes with it messes with your lungs, your breathing. It gets you have symptoms of hard to breathe, and
where did you learn that at?
I seen it on TV.
You see it on TV?
And as a matter of fact, they told us right here. The staff told us right here. We had a coronavirus thing that they did on us. We were on what you call that on.
Like
I forgot what you call it. Orientation? Yeah, not orientation. What's that other word?
Did they have like a meeting on the unit?
Yeah, we had like a meeting on the unit because somebody right here got sick. When the staff got sick with somebody,
Okay.
And they made us take a test, coronavirus test.
Oh, that's good. That's good. Oh, a test. Did they put a thing in your nose?
Yeah, they put a Q-tip in our nose and they.
Okay, good. Okay. Let me ask you this: are the patients on your unit wearing masks?
Yeah, it's if you want, you can wear a mask. If you don't have to.
Have they asked you guys to wear masks?
It's not mandatory.
Have the staff asked you to wear masks?
Yeah, they tell you to wear masks, but if you don't want to, it's not mandatory.
So the staff do ask you to wear masks?
Yes.
Okay. All right. So let me tell you something, Mario. It's very dangerous for you to be handling that laundry, okay? Because you can get coronavirus, or at least I'm not an expert, but they tell you to stay away from each other, correct?
Yes.
They tell you to stay away from other patients.
Yeah, like 6 feet apart when we get in line.
Let me just. I want to be quick here. So if they're telling you to stay away from other patients, doesn't it make sense that you shouldn't be touching other patients' dirty laundry?
Yeah, but I'm wearing a mask, so
I know,
it doesn't bother me.
But I'm just saying, at the very least, you definitely would want to be wearing gloves, don't you think, when you're touching other patients' dirty laundry? So I want to just tell you, the reason that I'm concerned is that you should not, under any circumstances, be touching dirty laundry of other patients. You could get sick. I'm not an expert, but I'm very concerned about you guys, okay?
Yeah.
And do me a favor. When you handle the dirty laundry until we can get this fixed, will you please put some gloves on?
Yes, I will.
Would you ask the staff for gloves? Okay?
What's that?
When you handle the dirty laundry?
Yes, I will.
Until we can get this fixed. I really care about you guys, and I'm really concerned, okay?
Okay.
It should not be happening. How old are you, Mario?
I'm 43.
43. Do you have family?
No, I don't have family.
You have no family?
Yes, I have family.
You do or don't?
Yes.
When's the last time you talked to your family?
Last week.
Last week? Do you have their phone number?
I have it, but my mom don't want me giving it out, so I can't give it out.
Okay. All right. Well, because I'd like to call your mother and talk to her and tell her what's going on. You know that you're in danger. You're in great danger, Mario.
Yeah.
Okay? After this call, would you let me call her and tell her what's going on?
I can't give her a phone number.
Okay. Well, do me a favor. We have a YouTube channel, and we're probably going to put this on YouTube. But do me a favor. Listen, we need to find something else for you to do besides sorting that dirty laundry. Okay? And
who else is going to do it? If I don't do it, somebody else is going to do it. So it's not going to end right there.
It's okay. It's okay for you to do the clean laundry. I mean, hopefully they'll allow you to continue to do the clean laundry. But you could die. You could possibly die from doing that. Okay?
Yeah.
And it can affect your peers. You know what I'm saying? So do me a favor. At least until they make a decision about the dirty laundry, wear some gloves, okay?
All right.
Do me a favor. Wear gloves and be careful. And make sure you wash your hands after you touch any of the dirty laundry. And don't touch your face, okay?
All right.
Wear gloves, and then after you sort the laundry, take the gloves off, and then wash your hands real good, okay? And hopefully the staff will start doing the dirty laundry. I don't want you to lose your job. I want you to be able to continue to do the clean laundry and everything. I want you to get paid for doing that, okay? Because I know you guys need the money. But please, now I'm going to check back with you later, okay? Another day. But I love and care about you guys, okay?
All right.
We need to stop that dirty laundry business, all right?
Okay.
And I appreciate you talking to me, okay?
Okay.
But it's not good. It's not a good thing, okay?
Okay.
Okay?
Yeah.
And you definitely should don't ever touch that dirty laundry with your hands.
Okay.
Yeah, my name's Jeff, by the way.
What is it?
My name's Jeff.
Okay.
Okay, and I'll call you again in the near future to see how you're doing.
Okay.
Okay?
All right.
All right. You take care. All right, Mario?
Okay.
And if anybody messes with you, you tell them to back off.
All right.
Okay, and I'll be checking back on you. Okay?
Okay.
All right. God bless you, all right?
All right, you too.
Okay, bye-bye.
Bye. Oh.
Yeah, is this Kevin Long?
Yes, sir.
Okay. Yeah, my name is Jeff. I'm with the YouTube channel, DSH-ABUSE. And do you consent to being recorded?
Yes, sir.
Okay. Today's date is August 19th, 2020. And you're a patient at Atascadero State Hospital, correct?
Yes, sir.
Okay. And you are committed under what's called a 5358 under the Welfare Institutions Code. That's called a conservatorship?
Murphy's conservatorship.
A conservatorship?
Murphy's conservatorship.
Murphy,
it's Murphy, not Murphy's, Murphy conservatorship.
Murphy conservatorship.
Yes, sir.
Okay, and also a 1370, which is incompetent to stand trial?
Yes, sir.
Okay, in Atascadero a couple of years.
Mm-hmm.
Okay, and you're currently assigned to the job of the laundry?
Yes, sir.
Okay, and you've currently held that position for a couple months?
I've had it for about 4 months or so now.
4 months. Now,
yes.
Is that before you lost it and got it back, or you lost it?
Yeah, I've had it all together about 6 or 7, maybe 6 or 7 months, 8 months, something like that altogether. I lost it for a couple months.
Why did you lose it and then get it back?
I lost it. I made a comment to one of the staff members in one of my groups that I wish we could have sex. And
you want to have sex with one of your staff members?
Yes, I just said I wish we could. I didn't really want to right then and there, but I told him I wish we could.
Oh, so you lost your job for that, and then you were giving it back.
Okay, yes, sir.
Well, that's not really relevant to our discussion here.
Okay.
All right. And is everybody on your unit incompetent to stand trial, or
yes, they are.
There's
a couple people. They're all 1370 incompetent to stand trial, except a couple people have different commitments. I'm not sure what they are, but I know that there's a couple other people that have different commitment codes.
Okay. Do you know what your diagnosis is?
My diagnosis is schizophrenia.
Schizophrenia. Okay. And you're on medication for that?
Yes, I'm on Zyprexa.
Okay, Zyprexa. Okay. All right. Now, you get paid for this job?
Yes, I do.
Paid for this? How much do you get paid?
About $600 a month.
$600 a month?
600 to 650.
How many hours a day do you work?
I work a couple hours a day, but I don't work as much as I get paid for. They're lenient with me. I'm pretty blessed with the job. Okay. I don't work all the hours.
I would hate for anything to happen to that. So listen. You pass out clean laundry to the patients?
Yes, I do.
You fold it up and put it away on the shelves and stuff like that?
Yes, I do.
All right. What I really want to talk to you about is the dirty laundry. Tell me about what you do with the dirty laundry.
I take the dirty laundry. They put the dirty laundry in the bags, and I take the bags and I put them the patients. The patients put the dirty laundry.
When do they do that? When they shower?
When they go in the shower, they take off their dirty laundry and put it in the bags. And take in
are the bags laundry. Just laying there, or are they in like a?
They're on a metal cart that they fold over. It's a specially made metal cart.
Kind of like a hamper or something.
Yes.
Okay. So they throw their laundry in there, and then what do you do? Does the laundry get thrown on the floor too, kind of hanging out the bag and stuff like that?
It doesn't get thrown on the floor too much, but it's hanging out of the bag a little bit, and I have to go in there and stuff it in.
Yeah, stuff it in and stuff like that. Okay.
Yeah.
And do you come across clothing that has like shit on it and feces and urine?
Yes,
and stuff
sir.
Like that?
A little bit.
Okay. And what do you do with that laundry?
I leave it in there. I just stuff it in. Leave it in there. I probably should be getting it into the yellow bags, but I haven't thought about that until now.
Okay, you don't do that. Yeah, you haven't been doing that.
No, I haven't.
Have you been instructed to do that by the staff?
No, I haven't.
You've never been instructed?
No, but I know that they do that. I know that when there's feces, when there's soil laundry, there's been a couple times where there's,
Okay, but they've never instructed you to do that when you.
No, they've never instructed me to do that.
Okay. Okay, never instructed. Okay, so they've never instructed you to do that. Bag. human waste. Waste. Okay, so how do you know about the yellow bags then if they've never instructed you?
Because I've seen them do it before. I know that we got to order yellow bags into the laundry in stock when they get low.
And you have red bags also?
We don't have red bags, but I've never seen red bags.
Okay, you've seen yellow bags. So, all right, and do you always wear gloves when you do this?
Yes, I do.
You wear a mask?
No, I don't wear a mask.
You don't wear a mask?
No.
Okay. And you do this unsupervised?
Pretty much. There's usually a staff member that stands outside the showers and keeps track of them going in and out.
But when you're picking up laundry and storing this over a period of time, are you doing this? Is the staff always watching you, or are you doing this primarily on your own without supervision?
I'm doing it pretty much on my own.
Okay. Now let me ask you another issue about masks on your unit. Are patients on your unit wearing masks?
Some of them do. Every once in a while, they don't constantly. We're not wearing masks right now.
Okay, what about the staff?
The staff are.
Do you ever see them taking their masks off in the offices?
Yes, I do.
You do? How often?
Pretty often.
Pretty often?
And there's some of them that kind of don't cover their nose. They just wear it over their mouth.
Okay. And you've seen that in the last few days?
Yes, I have.
Okay. Okay, where? Do you ever see them wearing it down below their chin?
I have seen it before.
Okay, recently?
Not recently.
Okay. Do you ever see them wearing their mask out and around the patients, below their nose and stuff like that?
Yes.
Okay. Have you seen it recently?
Have I seen it? Yes, I have.
Okay. Now let me talk to you about the patients wearing masks.
Mm-hmm.
Have they encouraged the patients to wear masks?
They was talking about it. The supervisors talked to me yesterday about that they was trying to figure out a way to encourage the patients to wear their masks during this COVID-19.
Have they ever brought you guys together as a group and encouraged you guys, like done a class or anything, a group meeting?
No, they haven't.
They've never had a group meeting on your unit?
No, I'm the unit chairman. Unit chairman.
You are the unit chairman?
Yes, I am.
Okay, good. Okay. But they never had like a unit meeting where they instructed. Do you guys know about? Do you know about the coronavirus?
Yes, we do.
Okay, how did you learn about that?
How long have I known about it? Ever since March.
How did you learn about that?
The news and stuff.
News.
Television.
Okay, what about your peers? Do you think they know about it?
Yes, they know.
Okay, how do they know about it? From the news?
From the news and from they talk when they have group meetings. They talk about it a little bit.
Okay. But do they regularly instruct you guys, or have they instructed you guys on you guys all need to wear masks and that sort of thing?
No, they haven't.
They have not.
No.
Okay. They have not. Okay. Listen, I'm not instructed unit on wearing masks.
I would rather not wear a mask. I'm not concerned with the
they're
virus.
not really comfortable. But okay, now listen, Kevin. I need to. Remember, I told you that I was going to save your life when I called you, and I need to give you some information. And you gave me the phone number of your sister, and I'm going to give you a call. Okay.
Okay.
I don't mean to be being the bearer of bad news. Okay.
Mhm.
But have they talked to you about social distancing?
Yes.
Okay. Social distancing means you guys need to stay apart from each other.
Mhm.
And that means, you guys need to do everything you can to stay apart. Now, that means it doesn't make sense for you guys to all stay apart from each other, and then you go in the laundry and touch everybody's dirty laundry.
Yeah.
That doesn't make sense.
I understand. I thought about that.
You thought about that?
I thought about this with the COVID-19. If there was any COVID-19 that I have.
It is dangerous. At Atascadero State Hospital, it's against policy for this to happen. They were paying patients coffee and soda to do this. I honestly don't know what the policy is at your hospital, but I can tell you that they're endangering your life. They're punking you. They're punking you. Okay? and it's not worth any amount of money. Now, I'm telling you something. I am going to be pissed, okay, if they take your job or your money from you, okay? And if they do that to you, it's going to be retaliation, okay? They need to find something for you to do. It's okay for you to continue sorting laundry.
I want to start my own. I want to start my own government.
No, the clean laundry. Listen, let's just focus on this for a minute. Okay. They should not punish you or take your job from you. Okay. It's still okay for you to do the clean laundry. I believe. Okay. I don't think there's a problem with that as long as you're wearing, appropriate. I don't know, but that's not for me to decide. Okay. This is very dangerous for you, and it's dangerous for your peers. Because if coronavirus gets on your unit and you're touching dirty laundry, you can not only, I believe, infect yourself, but you can affect other people. You can even affect the staff. Okay?
Yeah.
I want you to know I care about you guys. I care about you as a human being. I run a YouTube channel. It's like something. You know what the internet is? Okay. So I don't want you to feel that I've betrayed you or I've done anything wrong to you. Okay. I want you to understand that you're in great danger. Okay. From doing this, and they should have never had you sorting this laundry in the first place. Do you understand? Okay. You don't want to die, do you?
No.
You don't want to get sick.
I'm not too worried about the coronavirus.
Well, you should be concerned about it. Okay. I need to wrap this up. Okay. We're running long here. But I'm gonna give your sister a call and just express my concern about you and make sure she's aware of the danger that you're in, and so she can talk to you. Okay?
Okay.
All right. And I'm gonna.
I want to start my own government under free exercise of religion.
Okay. Well, I wish you good luck with that. Okay.
Yeah.
I just want you to know I'm concerned about you, Kevin. All right. And hopefully they will continue to find some work for you to do there. Okay. And they will continue to pay you good money. You understand?
Yes, sir.
But do me a favor. As long as you continue to handle that laundry, please wash your hands. Don't touch your face.
Yeah, I do.
Okay. More than likely, they will stop you from doing this in the near future, the dirty laundry at least. Okay? And if any staff member harasses you or torments you or does anything about this interview, I will be checking back with you, and I want to know about it.
Okay.
So trust me, we'll check back with you. If anybody harasses you, you write their name down, and I will follow up with you about that.
Okay.
Okay?
Yes, sir.
I'll do everything I can to have your back.
I appreciate that.
As best I can. But stay safe and be careful with that dirty laundry until we can get them to have the staff maybe do that.
I'll be all right. What was your name again?
My name's Jeff.
Jeff. Yeah, Jeff, I'll be all right. Don't worry about me.
Okay.
Well, I understand your concern.
I'll be calling you in the future, okay?
Okay, Jeff.
Okay. God bless you. Bye-bye.
Bye.
Bye.
Hello?
Yeah, is this patient 0420?
Yes, sir.
Okay, and you're an NGI at Atascadero State Hospital?
Yes, sir.
Okay, and that's not guilty by reason of insanity, correct?
Yes.
Okay, and we don't want to refer to your unit, but we picked 0420 because that's a special number for you, right? That's you should be a graffiti artist or something. Okay, and that's so 0420 is that number means something to you, correct?
Yeah, definitely.
Okay, I don't want to say where you're from, and we're using that number because we don't want there to be any retaliation against you. And you've been at Atascadero, what, about a year and a half approximately?
Yeah, about that amount of time.
Okay, I want to be careful not to identify you exactly what unit you're on.
Yeah.
So you have a job handling doing dirty laundry and stuff like that, right?
Yes, sir.
Okay. You've also seen staff on your unit in the last few days not wearing their masks in the nursing station?
Yes.
Okay. Can you describe that for me?
Well,
by the way, before I forget, today's date is August 17th, 2020, and you consent to being recorded, correct?
Correct.
You consider being recorded. Okay. Describe what you have seen in the nursing station in terms of the staff not wearing their mask.
They'll pull it down below their chin.
Okay, and there's other staff around them?
Mm-hmm.
Okay. How often have you seen that?
Multiple times a day.
Multiple times a day?
Mm-hmm.
Okay. And in terms of the laundry,
Yes.
It'll be 2 minutes. What have you seen in terms of, okay, so you've seen that multiple times a day, and have you seen it occasionally outside the nursing station?
Yes, once in a while.
Okay, once in a while around patients. Now, in terms of the dirty laundry, can you describe what you have a job picking up dirty laundry in the laundry room and the shower?
Yeah. Yes.
Okay. Can you describe that to me?
Yeah, I have to deal with a lot of lower functioning patients, and they'll just like leave their laundry on the ground, and it's frustrating at times, and and I just try and do the best that I can, and try and do it without causing too much problems, just try to do my job and do the best I can do.
Is there bags for patients to throw the laundry in
yes.
in the shower room?
Yes, but sometimes they just throw it on the ground or on the bench and like on the floor in the corner.
And do you use gloves for that?
Yes, I do.
Okay. And you come across laundry with feces on it?
Yes, I do.
Okay, and what do you do with that laundry? Do you put it in a hazard bag, or you put it?
I put
do you
it in
have a yellow bag or a red bag, or do you just put it back in the white bag?
I just put it back in the white bag.
Okay, you don't put it in a red or yellow hazard bag?
No. I mean, they have those, but they're like very rare that we even get them, and I haven't even seen one recently. Okay, so they've never trained you to put those in biohazard bags? No, they haven't. Okay. So your other job is to pass out dirty laundry and clean laundry too? Yes. Okay. Do you always use gloves when you pick up the dirty laundry? When I pick up the dirty laundry, I do. Yes, sir. Okay. All right. Do staff supervise you when you do this, or you just do it on your own? They barely supervise me. I do mostly on my own. They trust me. Yeah. Okay. All right. I just want to advise you, man, and they're paying you like $7.25 an hour to do this? Yes, sir. Okay. I just want to advise you, man, the coronavirus is very serious, and, it's very dangerous for you to be doing this. I hope that they can find something else for you to do, because the virus is very serious, and I'm really concerned about you guys over there. Okay. I appreciate it. I'm going to go ahead and end this recording. Are you concerned about have they talked to you about the coronavirus? Yes, and I've been tested 3 times. Oh, you've been tested 3 times on your unit? Yes. Are the patients are the patients on your unit wearing masks? Only when we go outside the unit, and only if we request to wear one. Have they encouraged you guys to wear the masks on the unit? They basically kind of do, but they don't really say it too often. So they don't encourage the patients to wear the mask on the unit? They basically only encourage you if you're like coughing or look sick. Only if you're coughing or if you look sick. Or throwing up. Or throwing up. Yeah. So the staff are not encouraging you to wear masks on the unit? Not unless the patient appears to be sick. That's the only. Okay, not unless the patient appears to be sick. Okay. And you've been on that unit for how long? About 4 months. 4 months. Okay. Yeah. All right. I'm going to go ahead and end this interview.
Hello?
Yeah, is this patient 1321?
Yeah.
Okay. You're an NGI at Atascadero State Hospital?
Yes.
Okay, I just got done talking to you. We're using 1321 because we don't want to identify you and have you experience retaliation. You said you have family in Las Vegas?
Yes.
And they call you regularly?
Yeah.
Okay, and again, you're an NGI at Atascadero?
Yeah.
Okay, and you consent to being recorded for this interview?
Yeah.
Okay. So you have a job doing the laundry?
Yeah.
Okay. And they pay you $7.25 an hour?
Yeah.
Okay. And your job is to pick up the dirty laundry and pass out the clean laundry?
Yeah.
Okay. And can you tell me how many times a day do you pick up the dirty laundry? You do that in the shower, in the bathroom?
Yeah, only once a day.
Once a day. And what do you do with the dirty laundry? Do you put it in bags? What kind of bags?
Yeah, I put it in white bags, laundry bags, and then I put them in barrels. And then I take the barrels and put it in the front door, and then they take it outside the front door to have it picked up in the morning the following day.
Okay. And while you're doing this, do you find laundry that has feces and shit on it?
Yeah.
How often? What do you do with that laundry?
I either throw it away or I just keep it in the bags and just put it outside.
Okay, when you say throw it away, what do you mean? Just throw it in the garbage?
Yeah.
Okay, you don't put it in any colored bags or like a yellow bag or red bag?
No.
Okay. Have they ever trained you to put it in a yellow bag or red bag?
Nope.
No?
No.
Did you do this by yourself? Do the staff supervise you or anything?
No, I do it by myself.
You do it by yourself? And how long have you had this job?
Since September of last year.
Okay. Do you have a lot of low-functioning patients on your unit?
Yeah.
Okay. Let me ask you another question. Have you observed the staff cleaning the telephones every time you get off the phone?
No.
No, they don't do that? Okay.
No.
All right. And your family calls you every day from Las Vegas?
Yeah.
Okay. All right. Well, listen, thank you very much. I appreciate you talking to me. And you're aware of the coronavirus, right?
Yeah.
I just want to let you know it's very dangerous for you to be doing that, okay?
All right.
And, you can get the coronavirus, so we want to try to get them to maybe have you do something else, like maybe clean the windows or maybe dust or something like that. But it's very dangerous for you to be doing the laundry.
Oh, yeah?
And it's very dangerous. You could maybe die from it.
Yeah,
at least right now. Huh?
Yeah.
Are you aware of that?
Yeah, I'm aware of it.
Does it scare you?
A little bit.
Yeah. So we want to try to maybe get the hospital to find something else that you can do for the same amount of money. Like maybe you can clean the window. Does anybody clean the windows or anything like that?
Yeah, Sean and Lance Harris.
Well, we don't want you to lose your job. I know that money means a lot to you, and but we want to try to find something else that they could have you do. For that time.
Yeah.
But it's very dangerous. I don't want to say your name or anything. That's why I gave you a number. We don't want any retaliation to come on you, but it's we want you guys to be safe, and it's just very dangerous. Okay.
Well,
huh?
You know what I'm saying? Yeah.
So we want to try to get them to find something else for you to do. It's something that the staff should be doing. But all right.
Okay.
But we'll see what we can do. Okay. But God bless you, and thank you for talking to me. I'm going to call back.